Hi, I'm Edward Jacobson. I'm a gynecologist who's been in practice for over 30 years. My primary office is in Greenwich, Connecticut, and I have a secondary office in Beverly Hills, California. The last 10 years of my practice, I've specialized in restorative vaginal surgery, vaginal rejuvenation, and labiaplasty reduction. I'm glad you could join me today. We spend a few moments in this session to give you some more information about labiaplasty and what is involved in the surgery. You have to understand there's a wide range of normal when it comes to labia size and shape and regularity. And it is your prerogative to say you can do what you wish, what kind of surgery you wish to have, and for whatever reasons. Most patients that I see have issues with swelling and discomfort, with exercise. They're concerned about form-fitting clothing, and some people just have cosmetic issues. But it's your choice and nobody else's.
Dr. Jacobson is a board-certified gynecologist who has been in private practice for over 30 years. He was the chief resident in gynecology at the New York Hospital Cornell Medical Center, where he remained an attending physician and clinical instructor for over 2 decades. He is also a fellow of the American College of Obstetricians and Gynecologists. 10 years ago, he subspecialized in restorative vaginal surgery and has since performed thousands of procedures. Dr. Jacobson is one of the only physicians in the United States with advanced training in both laser and radiosurgery. Over the past decade, the technology used to achieve the best outcome for restorative vaginal surgery has advanced tremendously.
We're in the preoperative section of the ambulatory surgery center, where you would come after coming through the reception. You'll meet nurses like Jane and Marina, who will be taking care of you just prior to going in for your operation. The surgery is done under twilight anesthesia, which is the lightest level of anesthesia. You'll wake up approximately 2 to 3 minutes after the surgery has been completed. You go to a recovery room, and then you'll be discharged an hour later from the surgery center. You will go home pain-free, and you'll stay pain-free for 8 to 12 hours because of the long-acting anesthetic that I'll administer after you're asleep in the operating room. Labiaplasty can be done several different ways. It can be done with a laser. My preference is to use radiosurgery because it cuts the skin very, very accurately without causing any damage or thermal damage, and it allows for the healing process to occur very, very quickly with minimal discomfort. After you leave the surgery center, you'll go home, you'll be hearing from me. You'll come back and see me the following day for a follow-up visit before you're discharged. We're standing now in the Greenwich Hospital Ambulatory Care Center in Greenwich, Connecticut. This is one of 3 outpatient surgery centers that we use for surgery, the others being in Stamford, Connecticut, and in Beverly Hills, California, the 90210 Surgery Center. The most important part of your visit, of course, is the consultation, and this is where I learn about what your desires are, what you envision to have with the surgical repair. This is a time we sit down and talk about your medical background. I get to learn a little bit more about you. We do an examination. So let's come on down and take a look at the examination facility. In the examination room is where we have an opportunity to have you show me what your concerns are and gives me an idea of what type of surgery to plan out. After the examination, we go back into my office. We'll look at some before and after photographs and ultimately find what you envision you'd like to have. And probably the most important factor is selecting a professional who has the experience and the expertise to give you an excellent final result. Initial contact is usually made by email, a letter, Skype, or even a telephone call.
For additional information or questions, you can arrange for a complimentary Skype or telephone consultation by calling 203-869-8360 or emailing Dr. Jacobson at cosmeticvaginasurgery.com. An office consultation and examination is highly recommended to go over your proposed surgery, learn what to expect after labiaplasty, and to go over all of your questions.